Hi, I'm Dr. Om Prakash Jamadar. I'm consultant pediatrics and neonatology at Apollo Hospital, Navi Mumbai. I'm going to discuss with you about what are the care and precautions that we are going to take with the baby, particularly newborn baby, in this difficult situation of COVID-19 infection. So the first and foremost thing which is good to hear for all of us is like the COVID-19 infection, the incidence and severity of the infection is noted to be quite mild in the newborn babies, which is a good thing for all of us to know. During the process of pregnancy, the risk of transmission of this infection from mother to baby is quite less. The evidence is still evolving, so as the information is coming to us in comparison to adult, the risk of infection to the baby from directly to the mother to the baby is looking to be on quite lower side. So during the process of birth, it may be a normal delivery or a cesarean section, we or healthcare workers are very well prepared at Apollo Hospital to take care of the mother and baby in a way to prevent the infection not only for the baby but also to the healthcare workers, because the infection spreads quite quickly from one person to other person also. So that we need to take certain precautions. After the baby is born, we initiate breastfeeding within 1 hour of life. We know all the importance of breastfeeding in general, but with the COVID-19 infections, in spite of the risk of transmission from mother to baby by sneezing and coughing, we do take precautions and then initiate the process of breastfeeding to the baby as soon as possible. Particularly the first pill, the colostrum, what we call, is very essential for helping the baby to prevent this kind of infections as well as the infections in general. So that is the first thing. Now, what we are going to talk is into 5 steps, like how to minimize the risk of infection to the baby. Second, how to take care of baby in home. Third, how to initiate the breastfeeding. Fourth, we will be discussing about importance of certain medications, particularly vitamin D. And the fifth point, what we'll take care of, what are the symptoms when we need to get in touch with the healthcare workers. So first and foremost thing, how to minimize the risk of baby getting infection from the people in general as well as from the mother. As I told you earlier that during the process of birth, we do take meticulous precautions to prevent the infection going to the baby. After the process of birth, as an individual, as a mother and as a family, we need to have a united efforts to prevent the infection getting spread to the baby. The good part is the babies of our babies, they don't walk around and then they go outside to get the infection, but we people, they can be going outside and then from outside we can carry the infection to the baby. So I will suggest only mother should handle the baby as much as possible. She should avoid going outside for purchasing groceries or something else. Maybe her partner or other members in the family should visit outside to get the necessary things for the home, and at the same time they themselves should take precautions when they are going outside and after coming from outside. This is the first thing. In a situation, however, if someone else is supposed to handle the baby, they have to take precautions in terms of hand hygiene and wearing mask. In a situation where mother has got a COVID infection and she is actively sneezing, coughing, we strongly suggest and recommend them to use a face mask, which is a proper surgical face mask or N95 mask. But that doesn't stop us from initiating the breastfeeding as well as continuation of the breastfeeding. So the first and foremost thing, as I said, minimizing the spread of infection to the baby from the people in the surrounding as well as from the mother. We should restrict the visitors also coming to see the baby, because that also increases the risk of infection getting to the baby. Now, second thing what we need to discuss, which is again very important point, is like how to take care of the baby in home. So first thing is hand washing. So hand washing, as you are aware of, direct contact of the baby with dirty hands that can carry the COVID-19 infection can transmit the infection to the baby also. So we have to wash your hands with the proper steps that takes just 20 to 60 seconds. I suggest use a free flowing water and a liquid soap for doing hand washing. And the important steps of hand washing, I'm just going to demonstrate with this sanitizer in front of me. So first, wet your hands, take liquid soap on your palms, rub your palms to palms, then on the back, then on the front with folding of your fingers, both the sides. Then you take care of washing your knuckles. and at the end the thumbs, and then come back to the wrist backwards. So this way, whatever you have touched the surfaces, whatever whenever you have touched your face and nose, all that bugs are going to be washed away with water. And use a disposable towel or a tissue paper, so that again the chances of infection coming from the towels is also raised. After the proper steps of hand washing, we are going to handle the baby for the breastfeeding, or in case if you want to change the nappies for the baby. So when to hand wash? One is before handling the baby. Second, whenever you change the nappies. Third, after your food, as well as after you use your washrooms. So you have to wash your hands properly. In between, if you want, you can use a hand sanitizer also, but that should contain at least 60 to 70% of alcohol. That also helps to prevent the infections getting spread to the baby. The next important thing, as I told in the initial phase also, that breastfeeding is going to help a lot to prevent the infection. But before you handle the baby, make sure your hands are clean and tidy. Vitamin D is one of the medicine that is in research also, that they have found that vitamin D is helpful to boost the immunity. So even before COVID-19 infection, we used to give vitamin D supplementation to all the babies till initial 1 year of life. And again, with this COVID-19 infection and the role of vitamin D in immunity built up, we are suggesting very strongly that you should give your baby vitamin D supplementation. The next thing what is important for us to know is when to get in touch with your doctor. Now, symptoms of COVID-19 infections in babies are very variable. We have seen some babies coming with just loose motions and vomiting. Some babies do have a fever, cough, cold, runny nose kind of symptoms. So in this kind of situation, you should always get in touch with your healthcare workers and then take appropriate advices from them. So that will help to find out early whether the baby has got any sort of infection. It may be COVID, or it may be some other kind of infection that is contributing for these problems to the baby. So to sum up what we have discussed, first and foremost thing is minimizing the contact that baby is getting COVID-19 infection. Second, what we have discussed is the importance of the hand hygiene when you are handling the baby. Third, we have discussed about the importance of the breastfeeding, and then with role of vitamin D, and when to get in touch with the healthcare workers or your doctors who are nearby to you. So I hope this will help you to take care of the babies while you are in the hospital as well as once you go home. However, if there are any problems, always just get in touch with your doctors, so that they will help you appropriately. Avoid going outside unnecessary for routine things like going around with the baby strolling in crowded places particularly. So I hope this will be helpful for you. Take care, stay home, stay here. Thank you.